focus areas for 2016?
In 2016, in good dementia care in Australia, we'd love to see more resources being provided by the federal government, especially for community care packages, so people can stay at home longer with their loved ones where they want to be. It's best for them, it's best for the community, it's best for the taxpayer. So we need more resources to ensure that people being diagnosed with dementia can stay at home where they want to be. We want to develop dementia-friendly communities. We want Australia to be a place that can declare itself a dementia-friendly community. And we want every town, village and suburb across the nation to declare themselves as a dementia-friendly community. And I suppose the third thing that we really need to see is a reduction in stigma in the wider community. We want people with dementia to feel welcome, and that means we want people in the general community who may not have a lot of connection with people living with dementia. We want them to be open, loving and supportive to those people who are going through some of the toughest days of their life, those that have been diagnosed with dementia.
What do you love about working in the aged care industry?
The best thing about working in the aged care industry is the people that you meet along the way. Those that work at Alzheimer's Australia that are absolutely committed to caring for people who are living with dementia. But the real thing that makes it worthwhile is when you meet wonderful people that have been diagnosed with the dementia themselves and are dealing with it, or the magnificent carers. 1.2 million Australians out there caring for someone with dementia. I have the privilege of seeing such honesty and bravery and depths of compassion, people who go beyond themselves to care for another human being. That's a wonderful thing to see.
So what, in your opinion, are the biggest emerging issues surrounding provision of care for people living with dementia?
The biggest emerging issues confronting people living with dementia, there's a number. The first one, if you've been diagnosed and you live in the community, to ensure you get the right care, sufficient support to stay in the community as long as you want to. That's where people should be. That's where they deserve to live, at home. Second, if they need to go to a residential aged care facility, that we have those facilities of the highest possible quality. Because when a carer places their loved one in a residential aged facility, it's one of the worst and toughest days of their life. If we can ensure those facilities are very high quality with well-trained staff, that's a better outcome. And thirdly, if you've got dementia and you need to go to an acute care hospital, that you're going to get good care there by trained professionals who understand how to deal with someone. The worst place to be for someone with dementia is in an acute care hospital. The progression of the disease often accelerates during that period of time, so we need better care in acute care hospitals.